Welcome back, everybody. WAJR's Ask the Experts continues now. Tony Caridi along with Dr. Chad Micucci and Mark Hose. Mark's a physical therapist at HealthWorks Rehab and Fitness. And these two guys not only are fine, upstanding citizens, they are big supporters of the CVs of Clay Vattel. Of course, Mark, you're based in Blacksburg at HealthWorks. And Chad, it's been a decade now that you're the guy on the sideline there for Clay Vattel football, huh?
It's been a great 10 years. Got to meet a lot of great people and see a lot of great football.
Yeah, they've had a run going there, and we wish them the best here as the playoff picture continues to focus. Our topic here today is shoulder pain, and in our first segment, we talked a little bit about specifically about the joint, what's in there. Now, I'm going to throw at you guys some of the issues that people have with the shoulder, and you guys kind of, if you would, give us the definition as to what is going on. So, if I'm told my shoulder's hurting and they say it looks like tendonitis, specifically, what does that mean and what is the treatment option there?
All right. So when we're looking at a tendonitis, we talked about the rotator cuff and the tendons that wrap around the shoulder. Well, those can get inflamed either through overuse or just through an injury. So right now they're more not torn, they're just very inflamed. So a lot of the treatment of it is rest and ice, maybe some over-the-counter like, Advil or Aleve. And we start doing some physical therapy treatment trying to calm the area down. So that's usually what we try to do that with the tendonitis or even the bursitis, which is actually something very similar where there is these burses that sit in our shoulder. And there are these fluid-filled sacs that help with shock absorption, help with lubrication. Those can get inflamed and swollen, which can then push on other tissues and create irritation as well. And it's the same treatment. It's resting it up, using some anti-inflammatories, sometimes having to get an injection, and some physical therapy to help try to calm the area down, work on the posture, trying to work on the mechanics again.
These sound more chronic, right, than acute. These are problems that develop whenever we get into the inflammations that it's more of a long-term issue that all of a sudden crops up.
Yeah, I think that's pretty accurate. I would say that majority are, overuse type injuries and over time. So like Mark explained, it's an inflammatory process, but also what happens is the tendon, unfortunately, doesn't have the greatest blood supply either. And so there's actually a little bit of a degenerative change to the tendon, which leads to tears. And so you can have acute injuries. It's not super uncommon where someone will maybe fall down the stairs or fall off a high stool and then can't raise their arm up. So that's an acute rupture of the tendon. But most of the time, even with those, there's probably some previous issue that led to that occurring.
Right. Let's get into tears. And we'll walk down the road here of starting to talk about rotator cuff injuries. They are extremely painful, right? And they can leave people pretty much with the inability to lift their hand up, maybe up to their shoulder, or definitely not above their head. So what happens when you're diagnosed with a rotator cuff injury, torn labrum? What are the differences and what's happening there?
Well, usually with a rotator cuff tear, and we as we keep talking about these tendons, and the rotator cuff, when I want to raise my arm up, those four muscles will actually kind of stabilize the shoulder so that the deltoid and these other muscles can actually help raise your arm up. When one of those are torn, you're not getting that good stability of the shoulder, so you lose that ability to be able to raise that arm up like you would normally would. So you start seeing people kind of hike their shoulder up, or they have a lot more pain with it, and it affects what they want to do. So with that being said, normally with that, they're referred to orthopedics for them to assess, does something need to be surgically done with that, or is it something where is a small enough tear where they can just be rehabbed and get some function back with it with some modifications, or is it something that he needs, needs to see Dr. Micucci and get it addressed?
When you do the rehab, in essence, then, and this is really super generic, but if you've got four muscles in there, you're just trying to strengthen the other three around it to help support it?
You want to strengthen the other three, and we go back to the posture, work on the mechanics and make things look more supportive so that the arm can still be functional and can still be useful for you. And again, you're not going to be maybe doing what you want to do prior, but you're trying to get that arm to where you can utilize it properly, have the strength in it, and be functional with it.
Right. Chad, when you have someone present themselves with these issues, what are your options in regard to, obviously we do a ton of stuff arthroscopically with knees. What are your options as the progression goes to as far as the level of a procedure?
Sure. So by the time they come to see me, I'd say, and I'm making this number up, 50% of people, let's say half have already seen Mark or another physical therapist. And so at that point, like Mark said, they refer to me. So at that point, it's usually when I talk to them about, well, at this point, we may get an MRI to assess what's the severity, right? Everything's on a continuum. So if it's a small tear or maybe what we call partial tear, we may look at an injection. And so that's when you talk about the steroid or cortisone injection. It's very powerful medicine. It's not something you want to do multiple times in a short period of time, of course. And so if therapy doesn't get them to the point that they want to be at, if a shot doesn't get them over the hump, so to speak, then that's when you start talking about the surgical options. And so in my practice, I did an arthroscopy fellowship, and so 95% or more of what I do in the shoulder is arthroscopic. You're talking about 3 or 4 poke holes to repair the tendon back to the bone. In addition to that, you're cleaning out some of the bursitis that Mark alluded to earlier, removing some bone spurs that are causing what we term impingement, so when the tendon's getting pinched, and then certainly take care of some of the other issues. You mentioned labral tearing and things like that. So all that can be done very, very minimally invasive, which is nice for the patient.
The patient then, I would imagine, physical therapy afterward?
For sure. And for me, I think physical therapy is key in getting these patients back functionally. I can repair the tendon, but again, it's Mark and his colleagues getting these people back to a functional level. And people, I tell them in my office, it's a 3-month process, maybe a little shorter, maybe a little longer, but to allow that to heal, but then to get the motion back and the strength, it's a process.
We are talking with Dr. Chad Micucci and Mark Hose, and we're talking about shoulder pain. These two guys are going to be hosting a seminar coming up Wednesday, October 30, 7 p.m., free and open to the public, talking specific details about shoulder pain. So if you or someone that you know is suffering from shoulder pain, you'd like to learn more hands-on, check it out, 7 o'clock, HealthWorks, the Maple Drive location. When we come back, what about the full extent of a really bad shoulder? What about shoulder replacement, the joint replacement? What does that all mean? We'll get into that when we return. Stay with us. More coming up. WAJR's Ask the Experts.